Well, I'm going to,
Good morning and welcome to the full subcommittee work session on 7 of the 9 retained bills in House Executive Departments and Administration Committee. I would like us to start first with the Pledge of Allegiance and then we'll get to the members. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
do you have any volunteers to sing the Star Spangled Banner?
As much as we would love to hear the national anthem, I don't think we need to sing it in such a small space. We'll reserve that for session days. First, we will, in the subcommittee work session, first we will take up House Bill 525. That was the bill to transfer the administration of the program for the deaf and hard of hearing and the Board of Licensure of Interpreters for the deaf, deafblind, and hard of hearing to the OPLC. This was inspired because there was a pile of money that looked like it wasn't being used. That was just an artifact of COVID. The sponsor is no longer interested in moving forward with that. But we will move into an executive session as long as there's no objections to us just moving to ITL this bill. If anybody does want to move forward with it, I will be recessing this and bringing in the community that's impacted. And we'll make sure that we have the accommodations. But is there anybody who wants to move forward to pass this bill? All right, seeing none, I'm going to move us into executive session. We're in executive session on House Bill 525, and I recognize Representative Schmidt for a motion.
Thank you, Madam Chair, and I would like to move ITL on 525. Thank you.
Thank you. Are you seconding?
I'll second.
And seconded by Representative Sellers.
Thank you, Paul.
Is there any further discussion or should we just call the vote? I think as soon as our clerk is ready to call the vote, we will do that.
Sellers. 525. Let's do this already.
Thank you.
You're welcome.
Okay, Representative Slotchie,
Aye.
the clerk votes aye. Representative Pearson here,
I don't see him.
no Representative Pearson. Representative Bailey. Aye. Representative Sellers,
Yes.
Representative Kofod,
It's not here yet.
not here yet. Representative DeRoy.
Here.
Yes, yes works. Representative Kelly. Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Schultz.
Yes.
Representative Law.
Yes.
And the chair.
Yes.
I don't believe you called my name.
Oh, no, you did not call Representative.
In that case, Representative Groda.
Yes.
Sorry, I skipped. You're right. 4, 6, 14? Doesn't feel right. 4, 6, 8,
Yes.
10, 12, 14 to not 0.
14-0 with 2 absent. Given that this is unanimous, are there any objections to putting this on the consent calendar? Seeing none, we'll be placing this on the consent calendar. Thank you. We're going to move back into the full subcommittee work session, and next we're going to take up Senate Bill 182. This is relative to the Maternal Mortality Review Committee. This is one where the bill sought to do a number of things. The first section was to change the name so it was compliant with the federal statutes. It looked to change some of the data collection process so that it would end up blurring some of the lines on those data. It looked to add somebody from the corrections department and to add somebody from DCYF to the committee. Previously, when we had discussed this, I had brought what I sort of consider the skinny amendment to this that simply gives the name change. It gives a little bit about the operations of the commission of the panel so that they will actually bring recommendations back to their people, and that it allows for the contact of the members and close contacts. So that more people can be spoken to when there is a maternal mortality. With this, so this one I had previously distributed. I don't know if anybody wants to take a look at that and discuss it and see if we're ready to move into an executive session from there, or if we need more time on this.
I think we're ready to move to executive session.
Okay, fantastic. Then with that, I will open the executive session on Senate Bill 182. And I would move amendment 2025-2328H to the bill.
I'll second that.
Adopt them. Would you repeat the amendment, please?
Yes, the amendment is 2025-2328H.
Thank you.
So as I stated, this one, it keeps the person from the Department of Corrections being added to the panel. And it changes the name throughout. It allows to send the information so that it can be more efficient dissemination of information, and allows them to contact not just family, but not just one family member, but family members and close contacts, so that they can make sure that they get a full and complete picture. Is there any discussion that people would like on this? Seeing none, when the clerk is ready to call the roll, please do.
Okay. On the adoption of the amendment, Representative Slotchie.
Aye.
The clerk votes yes. Representative Bailey.
Aye.
Representative Sellers.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Aye.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Schultz.
Yes.
Representative Long.
Yes.
The chair.
Oh, yes.
14-0.
My apologies. Thank you. Okay, was there a second?
I'm sorry.
Sorry. Senate Bill 182. And seconded by Representative Sellers. If there's no further discussion, I'll let the clerk call the roll once he's ready. Take the time you need to get the papers right. We're not trying to rush you.
I'm stacking. Okay, on the OTPA, on SB 182, Representative Slotchie.
Aye.
Clerk votes yes. Representative Bailey.
Aye.
Representative Sellers. Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda. Representative Schmidt. Yes. Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Schultz.
Yes.
And Representative Long.
Yes.
14-0.
And the chair votes yes.
Oh, I'm sorry.
That's all right. I forgot to answer you last time.
Yep.
And seeing that that's unanimous, is there any objection to putting this on consent? Seeing none, we'll be placing this on the consent calendar. Next, I'd like to look at Senate Bill 185. Is anybody from OPLC here? Thank you. This was the bill to look at the investigations and to potentially put a different framework in place. The OPLC has been working through a backlog, and we had retained this bill because they were making good progress, and we wanted to get another update. So I look forward to hearing this update from Mr. Fry. If you could state your name for us as well.
Sure. Nicholas Fry. I'm the general counsel for OPLC. Nice to see people that are back and welcome people that are new. So just to give a general overview of where we are, and then I'll go through kind of July, August, and September. We've been putting a considerable effort into cataloging the complaints over the past year. So we're now moving into a stage of reassessing our investigation policies by using automation and instituting accountability measures to make investigations more efficient and transparent. My understanding is we do have some sort of a contract before GNC today, which will hopefully, if it goes through, help us with some software in that area. So let me just take you through each month here. So just so everyone knows, what I've got in front of me is our division director has started doing monthly reports to the boards. So the board gets the reports that are sitting in front of me, so they know what's going on as well, not just the legislature and ourselves. So I'm starting with the July one. So when she started as division director, she'd picked up on 3 things she thought were really important that we needed to address. The first is improve communication with the public. The second one was to make progress on the backlog. And the third one was to streamline and standardize the expert review process to make sure we're getting that subject matter expertise in there. And so with respect to communication, some of this stuff you guys had already seen at the previous hearings that we've had, but she created an auto response email so that when someone files a complaint, they're getting information back real time about how the complaint's going to be handled and where they can look for more information and what they should expect moving forward in the investigation. Once a complaint gets reviewed and there's a determination that it's legally viable, then at that point, the complainant is invited to speak with the investigator. So that process has been established. And then the third part of communication is updating the website to improve transparency and frequently asked questions. Some of that stuff you would have seen previously. Some of it's been updated even more since then. With respect to the backlog, which is another issue that she's been working on, is they did an audit of all the pending complaints. So that's been taken care of. And then what they started was they had a outreach program with letters. So anything that was in the backlog and it wasn't clear whether it had been addressed or not, we did a huge campaign across the entire investigation unit of sending out letters to say, hey, we'd like to check in with you. If you're the complainant, could you reach out to us? We'd like to schedule an interview with you if we haven't interviewed the person yet. So we've started that. We did a preliminary investigation for every pending complaint that we had. So we made sure that we reached out to the licensees to get a response from them and then also interview the complainants, as I mentioned. And so part of the backlog problem is obviously we don't want to move forward with complaints unless we have some communication back from the complainant. So some of the difficulty in resolving complaints has been complainants aren't actually reaching back out after they've filed something. So that is some of the backlog. It's not all of it, but just a nuance there. And then with respect to the subject matter experts, she met with, I think, somewhere around like 19 or 20 other states. She spoke with folks on the phone about what their processes were. And so that's what she did for the month of July, or that's what the report had. And then into August, she developed a team approach to complaint intake for the intake process. So they have weekly meetings twice a week where they go over complaints to determine whether they're legally viable. If they think it's legally viable under the statute, then you start the investigation immediately. If they think it's something that should be dismissed, then those complaints get sent down to whatever board addresses the complaint, along with a memorandum explaining why they think it's not viable. And then the board, she also created a form for the board to send back for those legal viability claims of if they disagree with it, they can explain why, and then the investigation would go on. If they agree with it, obviously the complaint would be dismissed. So she's started to establish those processes for that. She also established a protocol just for the preliminary investigation. So some of this stuff I've already talked about, but obviously getting a response from the licensee, interviewing the complainant, and then making sure that any relevant documents are subpoenaed immediately so that you have that stuff in the works. So that's helped streamline the process a bit. And she developed those systems by speaking with other states as well. Talked about that. She also has a process for if there's concerns with either from the Division of Enforcement or the boards that information needs to be shared with law enforcement, there's a process in place for that now to make sure if we see something that we think is criminal, that that's getting referred over to the appropriate agency. And then the other thing that she worked on in her August report was the peer review, which is just basically the subject matter expertise review of case files and how to deal with that. So she did some additional research too, reaching out to other states and seeing what they were doing and what worked for each state. And from that information, she learned that the states that are utilizing, I guess I'm going to put in like quotation marks, like free services, right? Either utilizing recused board members or, for instance, with Board of Medicine, we have a clinician panel. That service was working really well for those states as well. We also have the ability to contract with investigators. So we have kind of a hybrid model. And so what she's done for a system is, in the first instance, she's reaching out to the boards to saying, hey, is there someone that is able to recuse themselves from this matter that could help us out with this case? If the board has someone, then great, that resolves the situation. If we don't have that, then that's when we move into that contractor phase and start using money for that. And then, of course, with Board of Medicine, we're also filling out that clinician panel as well. Let's see. And then in September, she's also established a process of, for the initial complaint reviews. We had been sending complaints down, and it's been a longstanding practice of boards get complaints, they have folks' names on them. So she started redacting the names out of that so that decisions are made based upon the facts of the complaints as opposed to potentially just having that knowledge, especially in small communities, of who the person is. So those are some of the things that she's been streamlining and also putting in place for protocols and practices. And I think she's been doing a wonderful job. So.
Thank you. That's very helpful. And you said that there's a contract for software that will help you to further reduce the backlog by streamlining the process, assuming that's approved today.
Yes, that's what Director Juris is over there, and hopefully she doesn't have any hiccups. So.
Other questions? Representative Schmidt?
Thank you, Madam Chair. So, so this sounds very thorough, and I'm impressed by the amount of work that's been put into it. I may have missed it, but just for confirming, so this has been run past all the boards,
So
this proposal?
So each month, I've got July, August, and September in front of me. Each month, the board gets an update from the director. So she
Right,
gives
right.
this, yeah. So she is updating them and saying, hey, this is what we're doing. And she'll go down, for instance, she'll go down and speak with Board of Medicine and say, hey, this is what I'm thinking of doing with the clinician panel. So she is going down and speaking with the boards in addition to also sending this. So there is communication back and forth between the boards and OPLC.
Follow-up? Thank you. My question more was whether the boards are all aware, you've already confirmed that, but also B, whether the boards have all signed off on the proposed restructuring in terms of the various particulars of that restructuring.
Yeah, I don't know as every board signs off on it. I know that she, as I said, she goes down to meetings to get feedback and to tell them about what the process is, what she's proposing for processes. So they're getting input, if that makes sense.
Certainly makes sense, yes, but it doesn't sound like any of the boards are objecting to the proposed reworking and restructuring.
To my knowledge, I'm not aware of them objecting. I mean, in general, the boards just like the legislature wants to make sure that the complaints are handled appropriately and that we get that backlog down. So
Okay,
they would have similar concerns like that. But she is making outreach to the boards and trying to get their feedback.
Very good, thank you.
Yeah.
Or other questions from the committee? I actually do have a question for you as well. If In the case of somebody who's licensed and is not able to have and they can't be licensed if there's a felony. If somebody provides information saying that somebody has a felony and they therefore shouldn't be licensed, does it go through this process or does it go through a different process?
Yeah, so it can go either way. So under the disciplinary statute, which is 31012, has kind of the different causes of action that a board can discipline someone for, and one of them is having a criminal conviction. And so the standard in there is basically a mirror image. I'm not going to say it's exactly the same language as RSA 332G:10. So there's two different ways that we might find out about a criminal conviction. One is someone files a complaint and says, hey, this person is convicted of a felony. And then it would go through the legal viability process and then also get sent down to the board. So the board has the final say on that. So that's one way. So it could go through the disciplinary process. The other way is our applications have what's called background check questions on them. So one of the questions is, have you ever been convicted of a felony? So assuming the person reports truthfully on their application, then we would have that information. And typically what would happen, right, is one of two things would happen. If we have the criminal background check, it could get sent for what's called a licensing hearing, and it would apply the same standard that's under 332G:10, which is the burden of proof is on the board. It's by clear and convincing evidence. And it has to have a substantial and direct relationship to the profession they're seeking to be employed in or that they're seeking to renew it. So that's another way that it could happen, and that could happen either on renewal or it could happen on initial application. So two different ways, and then of course, as we've I think discussed maybe in other past hearings on different bills, that some boards have criminal background checks for initial application. Some of them are FBI criminal background checks. Those are mostly healthcare boards. There's a few boards that aren't healthcare. And then there's a couple that have the non-FBI ones, which are a little bit less complicated as far as making sure the legislation is appropriate so it gets approved by the FBI. And so examples of that would be like the Real Estate Commission would be a good example of that. So.
Thank you. So there's multiple pathways for that. So those are
Yeah.
not necessarily being held up, just working through this backlog here.
No. So yeah, no. Typically what would happen is there would be, so for a license, for example, on a licensing application, the first analysis, we just barely did a policy and procedure for this. The first thing an LSR does is they say, oh, someone answered a question, that they have a criminal background check. It gets sent to my office. I take a look at it and I say, would this even pass muster for potentially denying someone an application? So if someone has, for instance, like a DWI, and there's no causal connection to the type of work they do, that person's going to get renewed, and then it might get referred to enforcement to just make sure that we didn't miss anything there. If that
Thank
makes
you.
sense.
That's very helpful.
Yep.
If there's any other questions from the committee, Representative Groda?
Oh, sorry. I would like to make a request to the chair that at the beginning of next year in January, when this committee meets again, we would invite OPLC to get maybe a summary as to where they are, because it feels like this is the right direction that they're going in. I think the work is very thorough as well. And I'm okay with going into executive session with the caveat that we get another update in January, because this is an important change that was made. And I would feel more comfortable knowing that we'd made more progress in January.
And so you're suggesting that we move to executive session, ITL this, and then if the reports in January suggest we need to take action, then we do that through a non-germane amendment? Perfect. I think that's a wonderful idea. And with that, I'll open the executive session on Senate Bill 185. I recognize Representative Groda.
Thank you. I'll move ITL on House Bill 185.
Second by
Second.
Representative Schmidt. Sorry, Senate Bill 185
Second by
I am so sorry.
by Schmidt.
Yeah.
Thank you very much. That was very helpful. And now we're going to be voting because you guys are making great progress.
Sure. Can I just ask one clarification question?
Yes, you may.
So for the progress report, it would be helpful if I did a memorandum in the future, or is it okay to do an oral report?
I think an oral report works for me. Would anybody prefer a memorandum over an oral report to the committee?
I think it depends on what the nature of the report would be. If you get something that's extensive and so forth, it would be different than if it's a one page, one line.
Then I think we'll ask you to give an oral report. If we need more information, then we'll give you direction at that point as to what we're specifically looking for in a memorandum.
All right, thank you.
Thank you.
Thanks, Madam Chair. I think
Thank you.
that's workable.
If there's no discussion on the ITL motion, I'll let the clerk call the roll.
On ITL of Senate Bill 185, Representative Slotchie.
Aye.
Clerk votes yes. Representative Bailey.
Aye.
Representative Sellers.
Yes.
Representative Kofal.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Grota.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Schultz.
Yes.
Representative Long.
Yes.
And the chair.
Yes.
15-0.
Wonderful. And if, seeing that it's unanimous, if there's no objections, we'll place this on the consent calendar. Seeing none, let's place that on the consent calendar. Next, I would like to move to, back in the full committee work session, to House Bill 349. This is the bill around ophthalmologic lasers. And there's an amendment before everybody with basically putting some pretty solid constraints and training processes for an ophthalmologist to be able to perform, optometrist to perform the ophthalmologic laser procedures. And I apologize, I sometimes mix June and July, and sometimes other O words also get blurred in my mind, or at least in my mouth as I'm saying them. With this, we do have this amendment here, and I would like to invite representatives from the optometrists to discuss what these changes would do and how it would serve public safety and also be able to work on access. Thank you. And if you can give your name for the record.
Absolutely. Thank you. Good morning. Thank you for having me here. My name is Dr. Angelique Sawyer. For those that don't recall, I am a private practice optometrist, a practice owner in North Conway and Berlin, New Hampshire. So I provide a great deal to the northern part of our state where there is a lack of access to care. And so that is in part why I am here, but I also have experience performing these lasers in other states. So regardless of where I would practice and regardless of access issues, this is something that I have experience doing in other states and that I'm looking to have New Hampshire included in that. So the amendment that you have before you here, the parts, it's really Roman 4 and 5 are the new information. There was one typographical error in Roman 3. That was simply a spelling correction there. And so what has been added in 4 and 5 here is more specific information based on what came out of the hearing that we had back in January. There were a lot of questions around, in particularly the live experience. The original bill, as introduced, HB 349, did specify in Roman 2 the training requirements that there would be live experience required, that there would be outcome reporting requirements. Those were all things that were already there. But because there was so much question about that live experience and how that would come about when there are so many states and so many places where optometrists are not able to get this experience. And so that is where in Romans 4 and 5, we have spelled out that proctoring process. And so the details are there, and it does go into both New Hampshire providers that are already here and licensed that have not been doing this, as well as licensure by endorsement in a state that is already providing already has these privileges permitted, as we do have optometrists here in New Hampshire who have done this licensed in other states. We will have more optometrists that look to move to the state to continue being able to do the services they've done elsewhere. So that is specifically what the amendment spells out here. I do also want to provide an update that since we met in January, 2 more states have passed. So there are now 14 states in the country that do allow these privileges. Montana and West Virginia were the 2 that have been added to the list since January, I do believe, We may have sent an updated map with that information. So there are 14 states. Again, because there was a lot of information about this proctoring process and how we go about it in states that don't yet have these privileges. 6 of those states do have proctoring systems in place with minimum requirements for performing these procedures on live patients before they are certified to do these procedures on patients independently. So we're not reinventing the wheel here. There are states that are doing this, and this is what we're looking to bring here. Happy to answer any other questions.
Thank you. Are there questions from the committee? Oh, sorry, Representative Sellers.
Yeah, thank you, Madam Chair. So 4 and 5 have been added.
Yes.
In your amendment.
Yes.
1, 2, and 3 stayed the same.
Yes.
So what I'm looking at on 4 and 5 is making sure that person, whoever gets the certification, has meets certain qualifications.
Yes.
That's what this is all about, right?
Yes.
Okay, thank you.
Are there other questions from the committee? Representative Schmidt?
Thank you, Madam Chair. So my fundamental question is a procedural one. This looks to me like an expedited approval process with regard to something that the committee already wrestled with at a tremendous extent last session, and that ultimately got tabled in the full session, as I recall. So I am very open to expansion of the process for optometrists. Once it can be established that we have a training process, an approval process that meets all scientific requirements, but I'm certainly not ready to proceed with unless we've had a thorough examination. And my first question is whether we're going to have a subcommittee on this.
Thank you for your question with that. As we've looked at this, what this does is this brings about the language that we had asked for. The idea of knowing how many need to be proctored, how many live cases. A lot of the objections that we had heard previously were around the fact, the comparison between residency and the comparison with that and people who may or may not have had live human experience with these procedures. This sets out a pretty solid pathway, at least in my opinion, where there is the live human training. And actually, I would like to ask you, do you know the difference in how many procedures would be done in a residency, or should I ask somebody from the ophthalmologist?
I'm sure that you can ask them as well. We did provide, I believe, to you the ACGME, which shows the minimums. And again, what is listed in here does also have minimums, actual numbers of minimum procedures that would be required, which was set to mirror what is outlined for these specific procedures, and which are for these specific lasers, 4, 5, and 5, depending on that specific laser. And so that does mirror the minimum requirements of the number of procedures in an ophthalmology residency. That again is not all encompassing. There are providers who will, in doing those numbers of procedures, will not be proficient and will not be approved and will need to do more to reach that level. There are some who have done this in other states, and depending on how many they've done in other states, and they may still need to go through that proctoring process if they have not done a sufficient number of actually doing those. Just having been licensed in a state that had these privileges, if they were not doing them, they're not going to come here and start doing them without, demonstrating that proficiency.
Thank you. Yes, follow up from Representative Schmidt.
Thank you. So I would also like to add that there are several representatives here today who are either not regular members of the committee, and they're here with perfect legitimacy to fulfill the quorum situation. But there are also some brand new members of the committee. And as I say, we went through all of this. Not all of this, but certain aspects of the amendment in subcommittee and numerous other hearings last year or last session, and so forth. So I again want to see whether we're going to have a subcommittee on this.
Thank you. I actually will take this opportunity, which I did not do before. I would like to welcome Representative Diane Kelly as our new member of the committee. She is replacing Representative Sheehan, who is Vice Chair of Legislative Administration, which meets at the same time as our committee. So we're fortunate that Representative Kelly now is able to fit into her schedule to be on a committee this year. Also, Representative DeRoy is a new member of our committee as well, replacing former Chairman Carol McGuire. So welcome to you. And also we have as substitutes Representative Kofalt, who is familiar with this bill. And we have Representative Schultz as well and as a substitute. So I do recognize that there are some new names and faces. However, I do also recognize that this has been a large topic of conversation throughout the legislature as well. So thank you.
But my question was whether there's going to be a subcommittee.
I think that we may be able to move forward with this because this has been discussed. There will be debates back and forth. The question is, do we have enough clarity to move forward with conviction, or if we don't? So that's something where I'll be looking at the feel of the committee.
So in other words, the answer to my question was you haven't yet decided.
The answer is, unless I'm surprised, no, because I do believe that we have the information that we need with this. We will hear some more as well. Thank you. Are there other questions? Representative Sellers?
Yeah, thank you, Madam Chair. And this is maybe towards you or even Representative Kofalt. I'm just trying to find out, and I mean, Section 2 that says to adapt rules, and it seems like that A, B, and C really covers these new sections 4 and 5. You know, I'm just wondering, is there a reason we're maybe moving this way versus rules? Or do you think, is there an overlap? I'm trying to figure out what's going on.
Oh, thank you. That's very helpful. So when we give rulemaking authority, they can work within whatever authority we've given. They cannot make rules that are contrary to the legislation, either state legislation or federal legislation. So this sets minimum standards. It's possible that the board could adopt more strict standards as well. And that's one where there could be an argument there within the rulemaking process. I would actually, so within this sets the baseline, and it's a higher baseline than simply having the language that we previously had. I do believe that the board would have supported something along these lines, but this, if we pass this legislation that says that this is the minimum and these are the two pathways, they cannot set a lower bar than that.
And if I
Yes.
may, I will say that, yes, 4 and 5 are somewhat repetitive of what's already there in 2, but because there was so much confusion or question about it, we wanted to add more specific detail so that we could get to a point where people were comfortable knowing that the rulemaking would then go on from here and further flesh it out. Thank you.
And I do want to note that generally I try and put more of a cap on the rulemaking authority somewhere, but I think that stating that to establish the criteria for certification to perform these with proficiency, including and not adding further constraints, is appropriate given that this is a newer area. There are the 14 states, but I would defer to give a little bit more leeway to the board to set further guardrails than I may in a more mature state. Representative Groda?
So I want to ask you a question that has to do with referrals. Even though there are doctors who have credentials in certain areas, but yet themselves don't feel comfortable with the procedure and they will refer it to another doctor. And the same could happen in your field as well if these procedures were past the legislature. Could you confirm that?
Absolutely. There will continue to be a vast majority, at least initially, of optometrists who do not go forward in getting this certification, who will continue to refer. They may choose to refer to an optometrist who has gone through the certification process, or they may choose to refer to an ophthalmologist that is already doing these procedures. Even those of us who do plan to go through this certification process, as I do, I will still have cases where I could potentially do these, but I will choose not to, and that I will refer. As I refer patients now, I say to my patients, you know, this is an option of a procedure that might be done, but you're a more complex case. They may decide that this needs to go another route, and that's why I'm sending you here. And that will still happen. Even when there are complex cases, there will be some that I will not choose to handle myself, and that I will refer on to somebody who has the ability to provide more care should that care be needed. But there are very frequently cases that I am seeing that I know that this is the next step that needs to be done, and I'm telling my patients that because of where I am, I'm not able to do that, but I know that that you will be in good hands in having these procedures done. That will continue to happen. Thank you.
Thank you. And these lasers have some safeguards built into them as well, where if it is something that is outside of the scope, the devices will not allow the procedure to happen.
To some extent, yes. Lasers have risks. Lasers do have safeguards on them, but anyone who is not trained that sits at that laser and does the wrong type of procedure in the wrong part of the eye and the wrong thing can cause harm. So there is no laser that is going to prevent any complication from happening, and that is why we need to ensure that only properly qualified, trained, and experienced individuals are doing these.
Thank you. Representative Schmidt?
Thank you, Madam Chair. So the question I have is if you're, I have had not laser surgery, at least since I was numbed for the procedure I was not aware whether a laser was involved. And I hope that's the only numbness that I evidence in ordinary practice. But the thing is, if an optometrist is not yet been trained to do some of these procedures, is it safe to say that they may not be able to recognize exactly what needs to be done? And the ophthalmologists are the ones that are trained to do all the procedures involving surgery on the eye, whatever the methodology would be, as I understand it. Isn't there a danger that somebody, you have already testified before the committee before with regard to the fact that you are doing a lot of stuff up there in your lonely practice up in the North Country. But one of the problems that the committee investigated in the previous go-round was the fact that there's not enough access in the North Country and not ready access and so forth, and that very often patients have to come all the way down south. That can be a great inconvenience as well as possible, in my view, an endangerment of the prospective patient in terms of the delay and so forth. And so I'm troubled with the idea that someone who doesn't have the training, well, I mean, I understand that it's prescribed by the procedure in the amendment, but that somebody would be diagnosing that does not have the same level of training and experience as an ophthalmologist would have.
So the procedures, these 3 procedures, are things that I am already diagnosing and treating. The one that pertains to after cataract surgery, that is not something that I'm able to treat, but it is something that I am diagnosing, that I am referring to someone to do the procedure, and I am managing complications when that arises. I have patients who, days after having that laser procedure done elsewhere, call me because they have pain and they are not able to travel to the surgeon that did that. So I am managing those complications. The 2 procedures, the 2 in-office laser procedures that are used for treating glaucoma, I am already treating glaucoma in other methods. I am diagnosing glaucoma. To say that I don't have their training in glaucoma and that I shouldn't be treating glaucoma because I'm not an ophthalmologist is going back over the 20 years that we have had the privilege to do that in this state. So this is an extension of a way of treating glaucoma. And it is one that I am trained and certified and experienced in doing, have done in other states. And we would not allow, the board will not allow anyone who has not had that training, that experience, to do that. And it will not match, it will not be the same way that ophthalmologists have gone about getting that experience and that training, but it is still a legitimate and verifiable form through 30 years of optometrists doing these procedures in 40 states, over 145,000 procedures by doctors of optometry with no increase in complication rate relative to when done by ophthalmologists, with no increase in malpractice rates in the states where these are done. So there is a track record of safety. There's a track record in the state that when optometry comes before you to ask for things, we don't come here to ask for things that are outside of our training and our experience. There's never been a rollback of what has been granted to optometry, and we would not be before you asking for this if there was any question that we do not have people that have gone through this process and that are trained and experienced in doing this.
Well, you're on the record, and so I very much appreciate all the additional information you had just given the committees. Thank you.
Thank you. That was very, very helpful. Representative DeRoy?
How long do you think it will take you to roll this out, and when you'll be able to actually start helping people up there?
So myself personally, I believe that within, once this passes, that it would probably take at least 6 months to go through rulemaking. The board is already aware that this is happening and has already had thoughts of what they would like for that to be, but obviously wait until, things go through. Once the rulemaking happens, people like myself who have already done the education, the training, the coursework, it then becomes a matter of doing the proctoring. There are optometrists in New Hampshire who are up to date and have done this very recently in other states. Those will probably be the first that will be able to start doing this in theirs. Because it has been some time since I have done so, I will need to go through that proctoring process. And that may be done with optometrists who are certified to do this in the state of New Hampshire through their experience in other states. It may be done through the ophthalmologists in my area that are doing these procedures and that I do refer to. They may be willing to allow me to bring my patients to them and do those procedures with them. To get the number of cases that are needed, for me in my patient base, I could within 6 months have the minimum requirements done based on the number of times that I am referring these patients, provided once I have the proctor in place.
Thank you. Thank you very much for that information. Next, I will invite up a representative from the ophthalmologist side. I do want to say one other thing for those who are waiting here. We won't be taking up House Bill 727 in the executive session, and we won't be taking up the other bill that hasn't been listed in the work session. So if anybody's been here waiting to see if we're going to discuss retirement, we will not be doing that today. So sorry to take that intro to do that, but I wanted to make sure that I was using everybody's time back there as best as possible. So if you could both introduce yourselves, the microphone will have a red light when it's on.
Turn it on.
You have to.
Thank you very much. Thank you, Madam Chair and committee members, for having us here today. We appreciate it very much. I'm Shakti Mehta. I'm the current president of the New Hampshire Society of Eye Physicians and Surgeons. I also happen to be faculty at Dartmouth and have been there for the last 10 years. With me here is Dr. Timothy Peters from Eyesight New Hampshire, who's been in practice for over 20 years. And he can speak to any questions you might have about our new ophthalmology practice opening up north at Androscoggin Valley Hospital in Berlin beginning January 2026. So I want to bring about this bill HB 349 as well as its current amendment as it is. We are opposed to the language in there and continue to be opposed to the bill. Our first and foremost concern is safety, and we have never wavered from this concern. Lasers are not simple, and there can be complications. You heard from a patient last year who came from Oklahoma who testified that an optometric procedure done by an optometrist led to blindness that was irreversible. The eye is the most delicate tissue in the body, and this cannot be overstated. Complications can arise, and the person that is doing the laser, you as patients expect that person to have adequate training to do that laser and also the experience to deal with complications when they arise. And that is real-time complications when they arise. And that is the difference between preserving somebody's vision and irreversible vision loss. Equally important is the ability to recognize when patients need these lasers. In our internal review of all the referrals from optometrists requesting glaucoma laser, our glaucoma division says that less than 20% of these patients actually needed the glaucoma laser. This would have rendered other patients subject to laser that they did not need in the first place. This is dangerous and unethical. In short, anyone providing lasers need to be able to deal with complications, and there's no shortcut to clinical training or experience to know that. Our second issue is the standards versus experience. This bill sets about minimum numbers that appear to be mirrored from the Accreditation Council for Graduate Medical Education, the ACGME. ACGME has been erroneously interpreted here as competency standards. That is simply not the case. ACG minimums are what physician training programs must conform to. So they must, number one, take a trainee that has completed medical school and a hospital internship, both which are already procedure-based. So this person has already delivered babies, set up IVs, done vascular surgeries, participated in brain biopsies, has done live training surgical experience that is mentored and observed throughout all those years of training. Number two, the institution has to provide these minimum numbers of surgical procedures of a vast array of real patients to the trainees in order for the programs to keep their accreditation. So the requirements are for the institution, not the individual. The institution, like Dartmouth, has to demonstrate that they have the volume, the complexity of cases, and trained faculty to train the next generation of eye surgeons. At Dartmouth, like everywhere else, residents are actually doing dozens and hundreds of procedures first before they even log on their first case. It's not just about numbers, but if you want to talk about numbers, there is a chemotherapy agent that we inject into the eye to prevent swelling or to control swelling. The ACGME minimum for the institution is 10. Our residents graduate with 200 to 300 of just that one procedure. Competency is about evaluating how somebody performs on all these procedures. They are doing invasive, less invasive procedures throughout that entire 4-year microsurgery training program. Depth and breadth matters for surgical competency. To isolate one procedure takes the institutional accreditation completely out of context and misrepresents what competency is. While the optometry curriculum includes didactic instruction of surgical procedures, meaningful hands-on surgical training does not occur and is not included. It would be impossible to do so, with 95% of optometry schools occurring in states where laser procedures are not permitted. So hands-on training, there's just not enough surgical candidates to provide these students, and there are 160 to 200 students each year in optometry school. Dartmouth graduates 2 surgeons a year. They experience depth and breadth of surgical training. This is important. This is important for safe and successful surgery to occur. There is published evidence from the Journal of American Medical Association that patients who receive lasers from optometrists suffer from poorer outcomes. They were 2 to 3 times more likely to require this to be repeated as compared to a laser done by ophthalmologist. Keep in mind, for those of us here who might eventually in our lives need one of these lasers, these should be a once-in-a-lifetime procedure. Eliminating training requirements to perform eye surgery is a risk we deem too high. Surgical residency allows the trainee, the surgeon, to have many options to treat a problem. It's like the analogy toolbox. If the provider just has one tool in their toolbox, that's the tool they'll use. A laser is not always the best option. Earlier this year in January, one of our optometric colleagues spoke about how a patient came into our office with high pressure in the eye. This is a vision-threatening condition. She said if she would be able to do this emergent laser procedure, one of the 3 listed here, she could have prevented vision loss and reversed that damage. This is actually not the standard of care. The landmark EAGLE trial says that the first line is actually eye drops to lower the pressure, and then the preferred and more effective outcome is actually cataract surgery, and that has had better outcomes. So I think we need to look at the data. We need to establish why depth and breadth is important. And in fact, what is happening here is an evolution. A non-surgical profession is trying to do surgery, and that is dangerous. I urge you today by asking you to consider all these facts. These are not just our patients, they are our community members, and will be your family members too. We are here not to limit anybody's scope of practice. We are here to say that this optometric laser done by optometrists are an outlier. This is not part of their core training. It is not fundamentally what they are trained to do. And we recognize this. There's a very small percentage, if you look at the data, of there's over 33,000 optometrists in the country. Less than half of 1% are actually doing these procedures. And data has shown that states that have passed bills similar to this does not increase or improve care to their citizens. Lowering the standard of care will have long and undesirable effects for our community. Thank you so much for your time. I would also like Dr. Peters to speak about our outreach project, and if you have any questions about that, kindly let us know.
Thank you. I apologize, I can't read your name. I know you made a comment earlier about if this was done, when could this care be provided to people who don't have it? I want to address the concept of people who don't have it. So when last the committee spoke, I met and spoke at the committee and gave the plan that we were going to open up access to the patients in the North Country through Androscoggin Valley Hospital. And I got a warm welcome and said, that sounds great, but let's actually see if, good intentions turn into good deeds. So today's the update. The short story is it is officially done, inked, signed contracts, the whole thing. We have a program starting January 9th where there will be ophthalmology care in the North Country at Androscoggin Valley on site every other week, starting January 9th. That will evolve in May 16th to also involve surgery in the operating room there. But the lasers and such, will begin on January 9th. This is a great collaboration between Androscoggin Valley, the whole North Country Healthcare Alliance, and the New Hampshire Eye Society, without the need for legislation or rule changes or considering standards or training. And it's kind of a groundbreaking collaboration, which I really hope that you all would want to support, and maybe even use it as a role model for other subspecialties that are still lacking in the North Country. So we're happy to announce that, and I appreciate your support on that project, and happy to answer any questions further.
Representative Schmidt.
Thank you, Madam Chair. So welcome, doctors. One of the questions I have ties into the testimony that you both have offered, and that is, as I understand the amendment, and it continues, the original proposal was that the standards and all the necessary rules and so forth will be established by the Board of Optometry. Okay, and so that's a great concern to me because many of these procedures will be things that the Board of Optometry has not been dealing with because New Hampshire has not, up to this point, permitted that. So the question I have is, if the Board of Optometry has to itself develop the necessary experience and expertise to provide the necessary rules and procedures and so forth for practitioners to be able to acquire and practice and then purvey to patients, what is the time frame that would be necessary to achieve actual safety on the part of new practitioners vis-a-vis the proposal that you're offering here that will start on January 9th, you say?
Yes, sir.
And you already have an ophthalmology board, I'm sure, that is overseeing all of your practitioners. And one of the issues that I asked in my question was the question of access, which we heard from the optometry side repeatedly that they don't have access, and it's obvious if you're living way up in the north and the practitioner is down in Dover or Portsmouth or wherever in the south end of New Hampshire, that the question of access is predominant in my view. So can you speak to that, please, both of you?
I'll do my best. I don't know how the Board of Optometry works, but access really through the rest of the state is pretty readily available. There's plenty of ophthalmologists, all licensed and trained and certified, who have the equipment and the time and the space to do these things. These procedures are rare. You know, in 1,000 cases, some of these lasers constitute, according to Medicare billings, less than 0.3% of the cases. So these are not commonly needed anyways. It wouldn't provide access to eye care for the people of the state of New Hampshire, because you might be covering a fraction of a percentage of care, as opposed to the proposal that we have, well, not the proposal, but the plan that's starting January 9th, where we're literally providing comprehensive care. We're doing the 100%, right? Representative Layton, you mentioned that these lasers have safeguards. They do not.
I asked the question.
Oh, sorry. I apologize. They don't. They are destructive lasers. So some of them create heat and burn, and some of them create energy and cause a cavitation bubble that causes photodisruption, right? So essentially an explosion to destroy the tissue. Whatever you point it at, that's what it's going to destroy. There is nothing in the machine inherent that is going to say you're pointing at the wrong thing. So no, they have no safeguards. I just wanted to clarify that.
I agree. I'd like to second that. And lasers are used across different surgical fields. They're even used in neurosurgery to destroy brain tissue. And it does require precision and skill and fine motor skills. And that's what a surgical residency does. Surgical residency is training somebody who does cataract surgery, who does all these intravitreal retinal procedures already, to do all these breadth of things.
Representative Groda?
Thank you. First of all, I want to address Dr. Peters. Of course, we're going to support whatever kind of access that our residents have, right? We'd be silly to say no.
Appreciate that.
Yeah. So I have a question for you. I would imagine there's a few ophthalmologists, perhaps the man who's sitting behind you, a doctor, are you an ophthalmologist? Yes, okay. So here it says that the proctor in this bill can be an ophthalmologist. So would any of you be a proctor if someone were to approach you?
The question really, Representative Grody, is can you take an established training program, a residency, where they take years to develop a surgeon, and pull a single piece out of that training program and truncate the educational requirements and the volume requirements and still deliver an experienced surgeon at the end of it? That's just not how things are done. It's just not how you train a surgeon. Me being able to do a cataract surgery helps me be able to do an intravitreal injection, which helps me be able to do a laser destructive procedure. Picking a piece of it has never been established. So I find that challenging to say. You know, if you look at this ACGME requirements, one of the things on there is you have to do 3 ruptured globes where the eye is literally popped open, right? So why not just say, okay, I'm going to do 3 ruptured globes, and the next gunshot wound that comes in, I'm going to go fix. It's not really sensical to use that as a guideline because it's a piece of the puzzle. It's not the puzzle. So that might be really challenging.
I'm asking all 3 of you.
I agree. I think that's just not how we cannot replace years of clinical training, hands-on training. And, you know, in January, one of our Dartmouth residents testified about how challenging it was, even though he had that experience coming beforehand of participating in surgery in real life patients, that doing even more microscopic work on the eye was not simple. And he required hours of direct supervision before he actually did his very first procedure, unaided but supervised.
I agree. The amount of technical skill it takes to do.
So you can be recorded.
Hi, Tim Blake. Good to see most of you again. Good to see all of you, but newly for the first time, some of you. I agree that the technical part of doing these procedures is lasers might be on the less technical spectrum compared to cataract surgery or retina surgery, but the technical part is just a piece of the puzzle. Importantly, as Dr. Mader said, it is the indications for surgery or when to do it. And this is when I think most mistakes when it comes to treatment with surgery or not doing surgery happen in the decision with the patient of when to do a surgery.
Could I follow up?
Yes, follow up.
Thank you. I'd like to follow up. So I've listened to this bill now for quite some time. And the last time we heard this, I asked for you to cooperate, you, the ophthalmologist, to cooperate with the optometrists. Because this is really on their neck, not yours. Their reputation lies on, they're putting their reputation on the line. And I'm disappointed that there hasn't been any movement. And maybe that is the position you feel you have to take, and I'm not going to criticize you for that. However, I do recognize that they've made significant changes. They've addressed the questions that were brought to them. And I do want to remind you that it is their reputation that would be harmed if something were to be, God forbid that it happens. I don't wish to harm on anyone. But you put us in a position, basically an uncomfortable position. And I just that's all I want to say. You don't have to respond, but this is how I feel about it right now. I'm sorry, but I feel that it's important to say that this bill puts their neck on the line, not yours.
May I respond?
You may.
Well, it is the post-operative care where we are involved. So complications like swelling in the retina after the laser, after cataract surgery, retina detachment after the laser, these are surgical issues that the ophthalmologists are involved and perhaps unnecessarily in some cases.
Representative Howard.
Thank you, Madam Chair, and thank you, doctors, for taking my questions. I've got a few. The first one is, how many surgeries do you perform a week?
15 or 20.
And follow up. And how many days are you going to be operating out of the Androscoggin Valley Hospital?
We need to find the volume that they have there first. So we're going to be there examining the patients on site every other week, see what volume we have. And we're starting with, for the remainder of 2026, quarterly surgeries on site. Not the lasers. The lasers we'll do every day, but the cataract surgeries in the operating room procedures quarterly. And 6 months into this, we're going to assess the volume that we've been having and see if we need to have more days.
All right, thank you.
Representative Copal.
Thank you, Madam Chair, and thank you for taking my question. So There was reference earlier to a case, I believe in Oklahoma, of a patient that had a laser surgery or laser operation on her eye, and it resulted in blindness. So my concern, I guess, is that that's an anecdotal case. Quick search kind of shows that there are also cases where an ophthalmologist has performed laser surgery. So do you have, and that has resulted in blindness. So I guess my question is, do you have any statistical support for the assertion that this is less safe when performed by optometrists?
Well, I can say that, you're correct that there's no surgery without potential risks, and there's very well-established risks we'll take in the case of the laser after cataract surgery. Like we said, swelling in the retina that can cause poor vision or retina detachment. There is a study by the optometrist Lighthizer, I think I'm saying that right, and this doctor presented to the Senate committee 2 years ago that there were 140,000, I think we heard the number stated, 140,000 cases of optometrists doing lasers without complications. And in the meantime, in 2023, this Dr. Lighthizer did a very nice study of optometrists. This is sort of like a proof of concept study, I think, to show that optometrists could safely do laser. He presented 89 patients that had laser without complication. But it's telling, and it's sort of contradictory to his testimony a couple of years ago, that the patients who were presented in this study, there were excluded patients who had risk factors for complications, namely patients who were diabetics or had diabetic retina disease, who are at risk for retina detachment. So this is a study that showed the safety of optometrists doing lasers after cataract surgery that did not include patients who have risk factors for complications. And you can use a lot of examples of these studies in ophthalmology literature too, with exclusions. That's not the point, but you've heard a lot about a lot of cases without any complications, and this is one study that said we're not even going to include the patients that are at risk for complications in the study to show that it's safe for us to do it. I'm happy to send a link of the study.
I would just add that it's well documented in all medical literature that newly trained and untrained and learning and beginning surgeons' complication rates in any procedure in any type of medicine are significantly higher. That's just how you wind up with an experienced surgeon at the end. So the question is why would the representatives from the state of New Hampshire want the people of New Hampshire to go through that process? What's the point? If you don't go through that process with surgeons, you don't wind up with surgeons, right? Maybe there's an access problem in New Hampshire, so we need to do this to provide this for the people of New Hampshire. And that's what I was told when we came here, when the bill came up the first and the second time. So we've done our best, and I think we've done a great job of providing a solution to the access problem. So now the question I would just put back is, why would you want to start that process on the people of New Hampshire?
Representative Copal.
Thank you. So just following up, so what I've heard is a challenge to a study that set out to prove the safety, but I still haven't heard any statistical or scientific evidence that there's a safety problem here. So I'm going to repeat that question. And is there anything out there that demonstrates that? And as far as experience goes, I mean, we heard earlier that there are optometrists who have performed many of these in other states that would move to New Hampshire, providing more patient access and or who have already moved to New Hampshire and have performed these in other states. So there is some experience out there. So I'm really looking for, sort of from an evidence-based perspective, what's the evidence of a safety issue or safety problem here?
Yeah, I get it. I provided you a corollary of, all surgical procedures where new trainees, new surgeons have higher complication rates. And I'm inferring that this would be the same as every other study that's ever been published on a new procedure, but it is not the direct answer to your question. Shakti did provide a study showing the higher complication rates in optometrists versus ophthalmologists. I'll have her reference that again. And we have tried to gather information about complication rates in the earlier states that had this for a longer period of time. And curiously, the boards of optometry in those states do not record complications, and they are not available for public record. So if someone complains to the board of optometry, there is no way to search for a complication.
Representative Schmidt.
Again, Madam Chair. So coming back to my original point of departure with regard of this examination on my part, and that is the original motivation of the bill, the optometry bill, was to get greater access for the people of the North Country to have high quality eye care without having to come all the way down 50 or 100 miles from their place of residence to the location where such services were available. And your proposal, which will now start on January 1st, will provide access at Androscoggin Hospital starting on or about January 9th. Okay. But the access issue also involves the possibility of optometrists, current practicing optometrists, presumably either down south who would move north. I would discount that as a very productive process in terms of numbers and greater access. But other optometrists would start to get the training once all the initial preparation steps have been completed, and there's a line of production of optometrists being converted into capable practitioners to do these 3 procedures that this bill calls for. So to the degree that we have your folks up in the North Country at Androscoggin doing something starting on January 9th, and the optometrist would not be able to do anything for at least something like 6 months, because you have to have the optometry board do its whole process of rulemaking and so forth and so on. Then these people all have to be trained. The number of people who are already up there, optometrists up there, so they can do these 3 procedures. So nothing is going to happen for the patients of the North Country until June or July, something like that. But the thing is, if we were to approve this, you'd start the process for people in that category to start the assembly line, if you will. Okay? I think that's me. Okay. How can I get this stop? Nothing like being interrupted at an inopportune moment. So you see where I'm coming from, doctors. This amendment offers an improvement in the original proposal from the optometry side. What harm is done if we start that promise?
Representative, you're asking for a conjecture on what the harm is done.
I'm asking my question, Madam Chair. You can rule me out of order, but I'm asking my question.
I guess my question, I want to make sure I understood. I'm sorry, Peter. Sorry, Representative Schmidt. I guess your question is why not pass this? And I think you stated that this is an improvement over the previous version of the bill that was submitted. This is some clarity on the original bill that was submitted. So the original bill that was submitted was the optometrist wanted to do these 3 laser surgeries and approve us for doing this. And once you approve us, we'll go figure out what good training and good experience look like, and then we'll go do it. Now the bill says, okay, this is what we've decided good training, looks like. We weren't, involved in any of that, and we disagree with that is good training. So I go back to the question for the other representative over there, is that you just know when you start with new people training on new procedures in a truncated educational system and a truncated experience system, you know that you're going to get complications. You know that even when you put them through the entire educational system and the entire experience, you get more complications than a senior surgeon does. It's just given. It's every study everywhere. So the question is, why do you want to do it?
You can answer as well.
Oh, thank you, Madam Chair. Yeah, we do not feel like there's a shortcut to this training process, and I sympathize with Rep. Jackie Grobe when she said that she felt disappointed that we did not participate and that this was their reputations on the line. And I have to say, in reading the bill, it says they can be trained by the virtue of an ophthalmologist or an optometrist, by the virtue. I would argue that by participating in a training program that is not verified, that is not tested, that is an atypical way to train a surgeon, is putting our licenses, our responsibility to patients on the line. And that is something that no ophthalmologist would really feel comfortable with. And that is my honest answer.
Thank you. Thank you very much for both of your testimonies. Thank you. Sorry, Representative Sytek.
I have one question. Assuming 349 goes through, is it better with Amendment 2969 or without it?
What is the 2969?
What's 2969?
That's an amendment you have not seen. That's the latest amendment on this.
Oh.
I think our point is it doesn't really make any difference. I don't think that it's anything new. I think it's a clarification of what they said they were going to do. Before it was vague. They said, we'll do some stuff. And now they wrote down, okay, this is the stuff we'll do. But we, on both counts, don't agree that that's, significant.
Do you have a question, Representative Bailey? No. Representative Kofalt.
Thank you. So you indicated that boards of optometry are not providing data regarding the negative outcomes. And I'm looking at data right now from 7 of the 14 states that permit this. With Oklahoma, it's data going back to 1988. And so out of tens of thousands, and out of those 7 states, 5 of those states report 0 negative outcomes, 2 report 1 each. And so I'm trying to figure out how that squares with this statement that boards of optometry are not making that information available, or that the information simply isn't available.
That's a great question. So, we provided written testimony from the societies of Kentucky and Oklahoma, where they have detailed out patient examples that is more than 1, that is more than 0, of all the patients they have seen that have been adversely affected with poor visual outcomes from lasers done by optometrists. And these are lasers that have been done there for a very long time. So they are poor outcomes. It's not that that doesn't exist. It's just very hard to report a poor outcome that is driven by a patient suing somebody, right? How often does that happen? And what we know about malpractice data is that it doesn't always correlate to the patient going forward with a lawsuit. So that is a poor measure of reporting outcomes. What we're looking for is the optometrists themselves to report the poor outcomes, which does not appear to be happening. And that has been documented by the states that have, and we can provide you with those letters detailing those multiple patients, some of which have needed more invasive surgeries. But that is a very clear mismatch from what is officially published. Do I answer your question, sir?
Follow up, yes.
Yes, somewhat. I guess, and I'm glad you brought up malpractice insurance, because my understanding is that malpractice insurers have stated that this change would not increase malpractice rates for optometrists who choose to study these, or who choose to perform these operations in New Hampshire, and that they have not in other states where this has been allowed. So I'm trying to, given the fact that insurance companies are they are the experts, they are all about quantifying risk. If they are in essence saying there's no additional risk associated with these procedures, is that not evidence that these procedures are safe when performed by optometrists?
So we can provide you with a letter from OMEC, which is the largest insurance carrier, malpractice carrier for all eye care, and they have their formal statement is that they will not cover optometrists who do lasers, because they have shown that there's no data to show that this is safe or effective or tested. So we can provide you with that information from the largest insurance carrier. Thank you for your time.
Thank you. And with this, I appreciate everybody with the discussion and dialogue. I would like to move us into an executive session on House Bill 349, and I would like to move Amendment
I
2020.
want to register my objection, Madam Chair.
You can register your objection. However, I was still making a motion. Please do not interrupt when I am making a statement. I will call on you in due time. As I was stating, I would like to move Amendment 2025-2969H to House Bill 349.
I'll second the motion.
Thank you. Representative Howard seconds the motion. I'd like to recognize you to speak now, Representative Schmidt.
I think this is entirely premature. This needs a subcommittee where we have an opportunity to ask the kind of questions and engage in the kind of dialogue that you can only get in this subcommittee, and that I will file an objection.
Thank you. Representative Groda?
Yes, thank you. I'm sorry that you feel that way. I feel exactly opposite. I think we have taken this horse, we have bludgeoned it to death, and I think it's time. I don't think any more questions or any more subcommittees are going to move any needle here. And I think the committee, I believe the committee has done a very good job on sussing out the important aspects of this bill. And again, I'll express my disappointment that we couldn't get to a compromise, but that's the way it is. And sometimes you just have to recognize that. And I just want to comment on your objection.
Thank you. And I'll recognize Representative Howard to speak to a second.
Thank you, Madam Chair. I think that this amendment especially is a huge improvement over the original bill, with sections 4 and 5 adding additional safeguards and protections to make sure that people are getting the proper training, is really something that I'm very happy with the work that's been done. And with that, I hope that you all support the amendment and the bill.
Thank you. Representative Sytek?
I will be voting for the amendment, but I want to speak to the bill itself overall when the time comes.
Thank you. Anything else for the amendment, or I'll have the clerk call the vote.
On adopting Amendment 2969H on HB 349, Representative Slotchie.
Aye.
The clerk votes yes. Representative Bailey. Aye. Representative Sellers.
Yes.
Representative Kofod.
Yes.
Representative DeRoy.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Since the amendment is an improvement over the underlying bill, I'll vote yes on the amendment.
Representative Davis.
Yes.
Representative Kelly.
Yes.
Representative Davis. Sorry. Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Schultz.
Yes.
Representative Long.
Yes.
And look, you need 15. Oh.
Representative,
I'm
the
sorry.
chairman
chair,
is yes.
Chair, yeah. So, again. Okay. That is the amendment. 15.
Thank you. I'll recognize Representative Groden.
Yes, I'll move auto pass on auto pass with amendment on House Bill 349.
And I'll second that. Would you like to speak to your motion?
No, I think we've said enough.
Thank you. I'll speak briefly to my second. There's been a lot of information back and forth, a lot that we've also had to look at the data that's been provided, look at the different processes. And I think that evaluating that comprehensive set of information gives us a more thorough picture than simply the discussions that have happened in any one of these hearings as we look at the data. And that's why I support this. Representative Sytek?
Yeah, if I may, this is a very close call for me, but I don't think I will be voting for the bill as amended, basically because of doubt and what people may characterize as hyper caution. Being pulled out at several directions, I'm not sure I believe or can interpret the statistics that Representative Kofalt and the doctors have brought forward. Just were there pre-existing conditions, lawsuits? This is very difficult for me to go through. What I am concerned about when I talk about hyper cautiousness is that we're talking about eyesight, vision. Look, everybody wants to travel when they retire. I'm going to travel in books. I'm being treated, now this is very personal, but brings home for me. I'm being treated for myopic macular degeneration. It's under control, but it reminds me every day of what the importance of eye care is. I have no doubt that the optometrists can perform this procedure appropriately, can do it competently. The question is, when we heard this first, this was touched on, long ago, this year, that ophthalmologist from Nashville called me and he said he was an optometrist, and I salute that optometrist, in good faith referred the patient to this doctor, and the recommendation of laser surgery was not called for in the opinion of this ophthalmologist and was treated in a different way. And I salute the good faith of the optometrist in doing that. My hyper cautiousness is, if anything goes wrong during this procedure, this is a real-time thing. I can't articulate in the way that the doctors, Dartmouth and Dr. Peters, whoever, talked about the nuances of what can go wrong. This is not white, black. I did it, I didn't do it. I can't tell you what things can go wrong, but I am not for this bill at this time. Please let me finish up with this. The North Country argument, I believe, has been successfully addressed and was the ostensible reason for this bill. Well, let's see how that works out. I am also concerned about a couple other things here. Or the other thing that I'm concerned about. If you look at the map, no New England state has been chosen. We don't know anything about Massachusetts. New York State hasn't chimed in. California hasn't chimed in. States with deep medical experience, expertise, we haven't heard from them. I mean, West Virginia's a nice place, but just a minute. Look, when some people say not yet, they mean never. That's not who I am. I can believe that this can happen, but I'm not prepared to do yet at this time, because one of the things I missed, and I'll conclude with this, is there is just one piece being pulled out, one particular procedure. This is, that's, that speaks to the, what about a complication? And for me, look, vision is just too important for me to countenance taking a risk. I think this is, I see the way the wind is blowing here, but I'm going to resist the wind. Thank you for listening.
Thank you. Representative Kofalt?
Thank you. So I just want to correct what may be a misperception that the access to care in the North Country was the prime reason for filing this bill. So I'm the prime sponsor on this, on the underlying bill. There's a broader context, and one of those is that statewide waiting times for these 3 procedures averages between 3.6 and 4.6 months, or those were the numbers as of the time that I filed the bill. So I think that while there has appropriately been a lot of focus on access to care in the North Country, as there often is when we talk about medical care, there is a broader concern for people statewide. And in fact, one of the people that I cited in the bill introduction, I unfortunately was sick that day and couldn't come before the committee, but one of the people cited in there was a patient who had a very, very long wait time and was suffering grievously because of that. So I think that this bill addresses a broader issue for the entire state of New Hampshire.
Representative Sajak?
Good enough, but this is an anecdote, but I never wait more than a month, okay? So.
Thank you. Representative Sellers?
Yeah, thank you, Madam Chair. I want to just make 2 points. And point number 1 is, even if this bill passes, I think we're 3 to 6 years down the road before we actually see a real big difference in New Hampshire as far as ophthalmologists doing these procedures, because it's going to take the cooperation of the optometrists, because they're the ones that are going to be having to certify and look at the training and approve. The second part of this is, again, if the bill passes, it's going to be a buyer beware. All right, you're going to go to an ophthalmologist or an optometrist. So which one does more procedures? You might want to go to that one versus the other. And I guess one last point I want to say, we live in New Hampshire. This is a freedom and a liberty choice. This gives the people the power to choose. All right, that's my last point.
Thank you. And I do want to state one of the large reasons, just to bring up a couple of those points, while an ophthalmologist could theoretically be the one to help proctor it, it sounds like that won't be offered. This does allow an optometrist who's been trained to do that. And I do note that we have optometrists here in the state that did this extensively in other states, and that we may actually have some optometrists who want to move to New Hampshire who have been trained on this in a different state, which would increase the access to care. Representative Sellers?
Yeah, thank you, Madam Chair. So, but there's got to be a first. So, right? There's got to be a first. Even if it's an ophthalmologist that's given the training, that person's got to be certified in our state. Who's going to do that? You see what I'm saying?
Thank you. That's part of the pathway for somebody who is already has an endorsement in another state. So there's the 2 pathways. So we would see first those people who've been trained in another state that come in and get that, because otherwise we'd have a vapor lock issue. And the last thing we want to do is appear to change our statutes, but not actually change them in actuality. And I do think that this may actually be something that, while you may be, some of the doctors who presented to us may be disappointed in the way that this moves forward, it sounds like you may actually be in support of some other legislation on providing more robust informed consent. And if you may have some suggestions on how we can make sure that patients have the full information, something I'd worked on in the past, and I'd be happy to work on it with you in the future to perhaps make it so that doctors are sharing that information. But that would be a larger scope around all of informed consent instead of layering layer and layer and layer onto one particular procedure. I think we need a more holistic look. And so with that, if there's no further, Representative Schmidt?
Thank you, Madam Chair. So I said in my opening statement that I am in favor of expansion of the optometry practice along the lines of the discussion that we've had. I believe that the process is too flawed and too premature with this particular bill, even with this amendment, which is an improvement, and I voted for it. But I think the very idea that the procedures are going to be developed by the optometry board, which they're not ophthalmologists, that's the gold standard. So I think that that structural, aspect of the bill, even as amended, is still a major factor. And I also think that this bill should have gone to the Health and Human Services Committee, which is the medical specialist committee, and not to us, and I objected to that in the first go-around as well. So I still will be voting against the bill as amended, with a proposed amendment. Thank you.
Thank you, Representative Schmidt. I would note that when I was Vice Chair of Health and Human Services, I did advocate to hear that in that committee. However, I believe that it has had a very full and thorough review. So with that, if the clerk's ready to call the roll.
On ought to pass as amended, with 2969 and HB 349. Representative Slechy.
Aye.
Clerk votes no. Representative Bailey.
Aye.
Representative Sellers.
Yes.
Representative Kofal.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
No.
Representative Davis.
No.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Schultz.
Yes.
Representative Long.
Yes.
Okay.
Representative Leon is
And
yes.
Yes, for the chair, that looks like 12-3.
Thank you, and I expect vigorous debate on this on the floor, so it obviously is going on the regular calendar. Is anybody planning to write a minority report?
Yes.
Thank you. Thank you very much, and with that, I will close the executive session on House Bill 349. Next, we have several other bills that are still on our still areas for discussion today here in the subcommittee work session. Two are relative to the building code. Those are House Bill 244 and Senate Bill 94. And the other is relevant to the Office of the Consumer Advocate. I'll move to the building code as right now.
Could you actually ask for the executive session?
I believe that I moved to the executive session when I did that.
Okay.
Yes,
Yes, she did. She
Okay,
did.
I just,
thank you.
belt and suspenders.
Belt and suspenders is always good. So with this, if we can hear from Mr. Phil Sherman on House Bill 244 with the amendment that he worked on with Vanessa Sheehan. She is no longer in our committee because she's always committed when we meet, but she did wonderful work. I thank her for it, and I appreciate the work that you've done as well. And this is the 3/8 of an inch thick amendment, I believe, that we have in front of ourselves. So we won't be voting on this one today. Actually, and I don't expect that we'll be making any more votes on these because we'll be hearing about a potential amendment to Senate Bill 94, and we do have an amendment for House Bill 610 that we will be discussing, but I don't expect us to vote on those today. So if you'd like to stay with us, we'd love to see you, Representative Schultz. If you don't want to, I understand that as well. But I will not be having any more executive sessions today. So, and with that, I appreciate you indulging my updates as you were sitting at the chair. So, Mr. Sherman.
Thank you, Madam Chair, members of the committee, some old familiar faces and lots of new ones. Congratulations on a big set of shoes to fill. We do appreciate the support never-ending support that this committee has given to the building code process in the state of New Hampshire. I would introduce this by saying that I'll go through this by sections, and I've bunched a lot of them together. However, there are the section numbers that were on our proposed draft, and I don't know what legislative services may have done with section numbers. So if anybody gets lost and wants to stop me or questions along the way, go right ahead. Just to refresh our memory, the original bill attempts to vacuum up all building code, building inspector, building code board of appeals, and related issues from what I'll call the RSA 670 series, 672, I think, through about 678 for our purposes, and move them into 155A, and then edit the 670 series for what's left that applies to the zoning. We've had a fair number of eyes looking at this, including the municipal association's legal folks. We've had no opposition. Everybody thinks this is a good idea. The question is, did we get it right? Because there's a lot of moving pieces. The replacement amendment, I guess it is, accounts for last year's HB 428. And HB 428 began its life to remove the ability for local amendments to the building code. But as part of that process, we picked up language that was in 4722, which was the enabling section for cities, and 67451, which provided requirements for all municipalities to enforce the code, and move those into 155A. So the sort of major surgery in this amendment was to get rid of the stuff that we've already done, in so many words. And 428 goes into effect next July. I'll come back to that in a moment. We also corrected some terminology. The model code used the term building official. Various statutes used other terms, building inspector and so forth, so there's some minor editing there, and we had fixed that in HB 428. And then many of the sections simply refer to pointers, so they referred to 67451. Now we've got to talk about 155A, whatever. The intent of this was that no authority for anything was eliminated or modified. There were some clarifications in that municipalities no longer adopt a building code. They enforce the state building code and amend it as appropriate. But much of that language was a holdover from prior to 2002 when we didn't have a state building code. So there was a little bit of cleaning up there, but it didn't take away any authority that anybody has today. And almost all the rest of it is just literally copying it over and editing it for grammar. I'd like to just pick off several sections where all those sections do is deal with the term building official or correct a pointer. Hopefully there's no arguments about that. I'll read them just for the record. 1, 2, 4, 5, 10, and then 13 through 19. So all those sections do is correct pointers to a statute, or they correct the term building official. There was a big one in here. Legislative services apparently requires a dash when you use the term third party. That wasn't ours, but sections 18, 36, 52, and 53 add the dash. Any disagreement there? That's a big one. Okay, so into the meat of things. Section 3 simply carries some definitions from the 670 series into 155A that are needed to make some sense out of everything else. Section 6 moves some building official authority to order a building vacated to 155A. Word for word, just transfers it over. Section 7 accounts for a lot of the paperwork in this bill. One part of it moves all of the local building code board of appeals language and moves that. And when I say move, it may mean copying, because some of this stuff needed to stay for zoning. But we move that to 155A, and also the adoption process for the ordinances that kick this whole thing off. And that goes through every form of municipal government and repeats a lot of stuff there. Again, copied that over word for word. Section 8 coordinates the requirement for a permit with the model code language. That was a little bit of a duplicate with what was in 155A, so we used the more robust language. Section 9 moves enforcement mechanism language into 155A. There were about 15 different zoning sections that allow the zoning side to direct the building official to not issue a permit. In other words, to put a hold on the permit while they figure the zoning stuff out. We've carried all of that in a big long list. Do not issue a permit under section whatever the statutes are, some 15 of those. Sections 11 and 12 bring penalties and the related process into 155A. Section 20 is where we move back over to the 670 series and do the editing that we needed to do there. So this, we basically take out references to building code, building officials, building code board of appeals, and otherwise just editing for, again, pointers or grammar to make it work. So these sections, and again, I'll read them for the record, 20 to 26, 29 to 35, 38 to 50, and 54 to 61. Section 27 and 28, there was an overlap where zoning boards of adjustment have the authority to issue a zoning permit, but never really had the authority to issue a building permit. They could direct the building official that they were okay with things. But we reworded that to clarify that whole section stayed on the zoning side, but not the building code side. Section 37 clarified that we don't answer to international codes. The model codes that are named international are not international codes. That's just a term of art. And then closing in on the end already, Section 62, at the recommendation of the Municipal Association, adds a definition of code into the 672 series, defining that as not including the state building code. I'm told that there are other codes that sometimes pop up on the zoning and planning side of things. 63 repeals a litany of things that were only related to building codes on the 670 series, so we've moved them all. We don't need them there. And then lastly, section 64 on the effective date, and I'm going to keep beating this drum to make sure it doesn't get lost. HB 428, for other reasons, was deemed to not go into effect until July of 2026. So it's signed, sealed, and out of the oven, but it's not in effect yet. It's critical that go into effect before this bill, if you choose to move forward with this, I hope. But without that, the part that's moved in 428, the rest of this won't make any sense at all, and we'll have a real lapse in thing, because we're repealing some of the stuff that 428 moved. So it's important with that effective date. And then lastly, there's another bill inching its way along to update the state building codes in sort of our normal process this coming season. So there's an LSR in on that. So we just need to make sure we don't overlap something with effective dates and overwrite something that we don't want to overwrite. Everybody got that?
Mostly. I do have one question for you because some of
Absolutely.
the numbers did change a little.
Okay.
Which was the one at the request of the Municipal Association?
That was, let me see if I can find it on the new amendment. It's right at the end. I'm thinking it's on page 30 because that was the old section 62 out of 64.
Was that just a 2-line removing code from the statute code, local ordinance regulation, or was that a different
No,
one?
it defined the word code in RSA 672. And I suspect they moved it because they put things in order, which means it would be back closer to the front of this.
Okay, but if that's the definition of code in 672 at the request of Municipal Association,
Correct.
we can take a look at that.
Yep.
Okay.
Yep.
Are there I know that I appreciate the work you did. Recodifying things is a Herculean effort, and I appreciate the thoroughness that you went through here.
When I reviewed this with Representative McGuire at the beginning, she had some legislative term for good luck.
Yes. And just given the size of this, I wanted to give people a chance to take a look at it and just make sure that we didn't mix an I with a T. Are there any questions from the committee on this? Representative Sitek?
How close is this to a once and for all?
I'll speak only for myself here, particularly with boards of appeal and how you adopt an ordinance. My impression, those two things not being my area of expertise, is that there's a lot of ink in here that the zoning side needed, but on the building code side, we may not need. But it's going to take somebody with a lot more knowledge of the mechanics of local governments than I to figure that out. If we come back with anything other than we find something that got missed, it would be to reduce some of the ink. That's not going to happen this year. We're not looking to make any changes this year.
Thank you.
Thank you.
Follow-up?
Mr. Sherman, is there somebody that knows more than you about this?
There are lots of people who know more than
Just
me about
wondered,
this. There's some gentle arm twisting we can do with the municipal association who have legal people on their staff and so forth. I think we need to let this settle in a little bit. But we really tried to make this a non-confrontational, don't take my little piece of this out because we'd never get through it.
Thank you. I appreciate the separation of codifying and then policy issues. So, if there's no other questions, thank you very much for this information.
Thank you.
Thank you. Next, we'll look at Senate Bill 94. Senate Bill 94 was the partner bill to House Bill 428. And it was raised to my attention that there was some language that may not have been intended to be part of the policy in 428 around the municipal amendments to the technical requirements of the state building code being permitted if the state building code is more than 2 editions behind the published model codes, because that is something that had been discussed. If we have somebody from the New Hampshire Home Builders Association, I would love to hear why this, a little bit more background on this, and then we'll take this information and marinate in it before we take any action.
Thank you, Madam Chair. I'm Phil Jazak. I'm Communications Manager for the New Hampshire Home Builders Association. This was something that came to our attention, as you mentioned, during the Committee of Conference for HB 428. And we just wanted to take this one sentence out because essentially it defeats the whole purpose of the bill. And it would allow, if the state were to decide, meaning you, the legislators, decide that you did not want to go forward with a new code adoption for 2 years, then that essentially leaves the door open for municipalities to use any code that they so choose. So the whole point of HB 428 was to make it so all the municipalities are on the same page with what you, the legislators, are want to have as the state building code.
Thank you. So it'd essentially be a choose your own adventure if we were not to adopt the newest code.
Correct.
Newest code. Thank you. Are there questions from members of the committee? Representative Groda?
I just want to make sure that because we, as a committee, have agreed to always be 3 years behind the current code. This does not change that, correct?
It does not. So this mentions additions. So the code additions are brought forward on a 3-year cycle. So that would be if we didn't adopt for 2 consecutive 2-year cycles, or 3-year cycles, excuse me. That's when that would come into effect.
Thank you. And so this would essentially lock us into either doing the current code, or I guess we're looking at the 1 behind code or 2 behind. And if there were changes that were untenable to the legislature, we essentially would then have no building code if that was the case. Correct?
Essentially, yeah.
Thank you. Are there other questions from members of the committee? Representative Gerda?
So if we don't have a building code, you're just saying, this thing is saying, is if we don't adopt that and we don't have a building code, what are municipalities supposed to do?
I'm sorry, can you rephrase the question?
If I can state what I was asking, that we wouldn't have a consistent building code, because if we did not adopt those two, then each municipality would be able to choose whichever code they wanted if we were more than 2 editions behind, which would then create even more variability than we have. Thank you. I phrased it poorly, but I think he understood what I was saying, but I was not clear. So thank you for clarifying that. Representative Bailey, if you put your microphone on, please.
Why would it not be that if there's no new building code, that the existing building code doesn't just remain in effect, as opposed to there being no building code?
Sorry. And when I said that it would be a choose your own adventure with no code, I meant no standard code, because if we went more than 2 editions, each municipality would be able to make amendments as they wished, because we were not within the 2 most recent. So we would still have the older building code, but municipalities that wanted to adopt an entirely different code would be free to do so with the language that was, I believe, inadvertently included in House Bill 428, and that has now been raised to us as this possible amendment.
Thank you.
See, that's what happens when there's not a coffee machine for me. My words become less clear. Thank you. Representative Schmidt?
Thank you, Madam Chair. So, first of all, I didn't quite get your name. You're new to me, so if you could be, you know your name, you're comfortable with your name, I don't know your name, and I'm not comfortable with your pronunciation of your name. Too brief, too quick, so.
Sorry about that. My name is Philip Jazak. Jasak.
Oh, interesting. That helps. Okay, so as you may know, there was a lot of opposition to this bill online, and I got people writing me saying, please don't do this, this takes away local control. I think some of it, the opposition is based on a failure to understand how the system really works, but please tell me why you think we should adopt a bill that is opposed by everybody on the public side that contacted me anyway.
Representative Schmidt, this is a replace all amendment. So this is turning the larger bill into more of a bill to address one of the potential oversights from House Bill 428. It deletes the rest of Senate Bill 94. So that all the testimony that we had received on Senate Bill 94, because this is a replace all, if we were to adopt this, all of Senate Bill 94 would not be.
Is there an amendment here I'm not seeing? Or?
Yes, it was passed to you. I believe it's this long. It was the one that was passed while we were speaking, because I was waiting to get that from OLS.
Okay, well,
It's the one for Senate Bill 94.
I don't have it, but I'm gonna trust it, because all I have is the original bill. What? Okay,
Yes.
that's very different from
So-
Bill Mitt.
Yes, as a replace all, if we were to adopt this, all the testimony saying that the entire bill was,
I get it. I just didn't have the amendment.
thank you. Yes. Clarity is always good. And if there's no further questions, thank you very much. We will take a look at this and then proceed forward on a different day. Thank you. And last but not least, this brings us to House Bill 610. House Bill 610 was the bill to eliminate the Office of the Consumer Advocate. What I have proposed instead of eliminating the office is to create more guardrails around what the office does. Some of what we have seen is there was a hearing report and it questioned some of the way that the Office of the Consumer Advocate had advocated on behalf of residential ratepayers. So this would allow it not just to be a qualified attorney, but also a professional engineer or an economist to hold the Office of the Consumer Advocate. It would also say that to have at least one attorney and consider appointing additional attorneys, rate analysts, in addition to the economists. And basically, it's trying to state that the Office of the Consumer Advocate will put forth the ratepayer-friendly legislation that we have. We likely would want to look at this and potentially, and most likely amend it to say that the Office of the Consumer Advocate will be pushing for ratepayer protections consistent with the state energy plan. So that would be more of an improvement on setting these guardrails, and it does also provide for more of a path of accountability should it be necessary for the Office of the Consumer Advocate. So, Representative Schmidt?
Thank you. I do see the amendment to this one, and I see that line 10 says qualifications, an attorney, and a professional engineer or an economist. I don't know whether the current tenant of this office is any one of those three. So would he be grandfathered if he's not one of these three? Perhaps he is. He's here, so he's going to testify.
I would like to hear from him as well as we're discussing this, but I believe you're an attorney. Is that correct? Yes. Yes, he is an attorney. This is simply expanding it so that as next time there's a search, there's a broader pool. Especially given that if this is residential ratepayer protection, the idea of an economist, as an economist myself, I'm a bit biased to that idea, but I think it should be one of the options available. So actually, Mr. Kreese, if you would like to come up and speak with us.
Thank you, Madam Chair, and congratulations on becoming chair of this committee.
Thank you.
And thank you as well for your work on this bill. Let me just introduce myself for the record. My name is Donald Kreese. I have, since February of 2016, served as the state's consumer advocate. Our job is to represent the interests of the state's residential utility customers wherever they arise, principally at the Public Utilities Commission, but other places as well. I am an attorney licensed to practice law in the state of New Hampshire, as is currently required by our enabling statute, RSA 363, Section 28. At your pleasure, Madam Chair, I'd be happy to share some thoughts about the amendment, which I have seen, at least in some version, draft form, or I'd be happy to answer questions, whatever would be useful to you.
Thank you. Yes, the amendment is on the counter there. Hopefully you were able to pick up a copy of that. And if you do have, sorry, Representative Sytek? Oh, sorry, I thought that was a hand. Yes, if you do want to take a look and give us your input on that and see if there's anything that would be a problem for your office, that would be helpful to know.
Sure. Well, let me say that I remain neutral on the bill. I think the right way for me to characterize my position is one of earnest confusion, because I don't know what problem or concern the bill or the proposed amendment really are trying to address. I haven't received any complaints from anybody about my advocacy at the state level. I've heard some speculation that some people don't like some of my advocacy at the regional level in connection with the regional grid operator ISO New England. Well, I'll admit to being an opponent of ISO New England, which I find to be unaccountable and arrogant. That's exactly why I supported House Bill 690 from Representatives Summers, Spillane, Bernardi, Nodder, and Harrington, which you adopted and which requires the Department of Energy to study possible withdrawal from ISO New England. That also happens to be the perspective of certain climate activists, although for somewhat different reasons. So in some ways I've found common purpose with them, but I am not, and I have never been a climate advocate. That simply is not my job. The amendment that I've seen would create two main duties for the consumer advocate. I recommend changing them. I respect the idea that it might be necessary or helpful to pin down what the duties of the consumer advocate are, because as you know right now, it just says represent those interests. It doesn't really impose any constraints or guidance, and I know legislatures like constraints and guidance. The duties in the amendment are framed in terms of choosing among various energy sources, but that's not actually what I do right now in order to represent residential customers at the PUC. We simply don't confront those choices, largely because we have restructured the electric industry and we rely on the market to determine where we are going to buy our electricity from. If I were concerned, or if I wanted to form some guardrails, here's what I would tell the consumer advocate to do. I would say this: pursue safe and reliable service at the lowest possible cost while maximizing customer freedom. I've thought about that a lot, and I could give you an hour-long disquisition about what I think that means, but that is a succinct framing of what I think the consumer advocate's duty ought to be. I have a few respectful disagreements. One, I respectfully disagree with abolishing the requirement that the consumer advocate be an attorney. Our mission is advocacy, and that is what lawyers do. The risk is too high that a non-lawyer consumer advocate could find herself with no lawyers on her staff, and that would be a very regrettable outcome. I respectfully disagree with reducing the size of the Office of the Consumer Advocate from 6 people to 4. We already have to forego quite a bit of PUC proceedings and other matters because we simply lack the bandwidth. My counterpart in Maine, the Office of the Public Advocate, has 3 times our budget and 3 times our staff, even though that state's population and utility service is comparable to ours. I respectfully disagree with the idea of allowing the governor to remove the consumer advocate for what strike me as potentially arbitrary and subjective reasons. As I said back when this bill was originally heard, our independence is our superpower. And I noticed that the amendment slightly updates the charge of our advisory board from advice to oversight. Mr. Kirk from our advisory board is here, and he can tell you what it is currently like. I treat our advisory board the exact same way a executive director of a nonprofit would treat her or his board of directors. And so they are providing oversight, and so therefore I can't really object if it is the general court's pleasure to make that explicit in the charge of our office and the advisory board. I think that's all I have to say at this time. I, of course, would be pleased to answer any questions. And I do want to thank you again, Chair Leon, because it's clear you've done some very thoughtful work and thought seriously about the work of our office.
Thank you. Representative Sitek and then Representative Schmidt.
Mr. Priest, this is the last bill we're going to be talking about. Can I ask you to hang around for a few minutes? I need a primer on just exactly what you do.
Sure.
It's sort of, I feel like I've carried water in a colander. It's all empty now. So
Representative Schmidt.
But not much water in a colander. So my question is a simple one. What is your opinion, since you said you don't like the fact that the current statute prescribes a person be a practicing attorney in the state of New Hampshire, adds professional engineer or economist? Are either one of those alternatives better than or at least as good as an attorney, which you already have spoken to?
Well, let me be clear. Currently on our staff, we have an engineer and a PhD economist. Those people provide me with excellent, valuable advice, input, and expert testimony. But ultimately, the consumer advocate was formed. Let me take a step back, and without delivering the whole primer, let me just say, if you go into the PUC's enabling statute and look at section 17A of RSA 363, you'll see that the PUC's statutory job is to serve as the arbiter between interests of utility shareholders and utility customers. So there's a scale. And the utilities show up with an army of lawyers and experts. They are very good at self-advocacy on behalf of their shareholders. So what the legislature did, starting back in the 1970s with the creation of the Legislative Utility Consumers Council, which was our predecessor, was it decided to put some extra weight on the other side of the scale so that the PUC could exercise its arbiter function more thoroughly. So that requires advocacy, that requires the kind of legal skills that an attorney who's been to law school and is licensed to practice law can bring. So I think the current paradigm works really well, where the consumer advocate is an attorney. He or she is participating as an advocate in a legal proceeding, matters before the PUC, and then he or she brings in his or her experts as necessary, depending on the issues that come up.
Representative Sytek?
I'd just like to point out, I don't know that all attorneys are created equal, in the sense that, do I want to trust and will expert doing this? I mean, so they had legal training, but they haven't touched this inside a courtroom for 100 years, so.
Quite so.
By the way.
And I'd like to ask you, Mr. Crease, about the workload and all of the things that you need to process as the consumer advocate, just to see if it's something that ebbs and flows with different issues, or if this is something that is just a constant churn of information coming through your office that you're constantly engaging in this process, or if it's more, as I said, ebbs and flows.
Well, of course, any job that anybody has some amount of ebb and flow in it, but I would say there is a constant supply of active PUC proceedings and regional matters. We litigate at the Federal Energy Regulatory Commission, where a member of the Stakeholder Advisory Board to ISO New England, NEPOOL, which is its own kind of weird sort of litigation-like forum, and there's always something for us to do. There are always cases and matters that we simply put aside because we don't have the bandwidth to do them.
Thank you. And then as a follow-up for that, I became more aware of your social media postings after you followed me on X. And I just was a little bit intrigued that a lot of your advocacy for other issues was happening during the normal workday. So I just hope that, so that we don't need to pursue with processes and all of this, that if you could keep your separate, unrelated advocacy to not right in the prime meeting times, that would be a lot more helpful for our transparency.
Representative Leon, the only other advocacy I conduct is in my capacity as the father of a young woman who has cystic fibrosis. And you will not get me to apologize for doing any of that.
Okay, so that is a workday thing as opposed to an after the work hours.
I am a unclassified state employee, and I typically arrive at the office at 8:30 in the morning, and I usually leave about 12 hours later. I work very hard in my job.
Thank you.
But yes, I do take breaks during the workday.
Some people take smoking breaks. Perhaps other people take social media breaks. That is, I'm not sure if it's a healthier addiction for any of us to be addicted to social media, but, you know, duly noted. Are there other questions from the committee? Thank you. We will take that information. Thank you for providing some of that insight. I would like to bring up Mr. Kirk to talk and see if that would be a significant change to the advisory board, or if that's essentially within the current roles.
Thank you.
Thank you.
Good morning, Madam Chairman, members of the committee. For the record, my name is Neil Kirk. I live in Ware, and I am a member of the Residential Ratepayers Advisory Board, which advises the consumer advocate. However, I am here in my personal capacity. I am not speaking for that board. I've not spoken to the members. I'm very pleased to see that you've given us, increased our authority from whatever it is now, and it's unclear, to oversight. I would point out, however, that to some extent we've already been doing oversight. This is my second three-year term. I was appointed by Speaker Packard, and I don't know why he chose this particular category, but I represent the elderly. I would have preferred a different category, but there you go.
You're only representing him.
Yeah.
Thank you, Representative Schmidt. I appreciate that.
Sometimes the junior members of a group need to be the ones who can speak for their elders. So thank you. I appreciate you representing that group.
What we've done in the past is to advise the consumer advocate. Basically, it's been a group that's being educated by bringing in speakers from various utilities to educate us. But last year, for example, and we, in the past, we've always said, you know, this is a good idea, that's a bad idea, this case should be fought significantly, this case shouldn't, and the consumer advocate has listened to us. This year, we adopted a different procedure with respect to legislation. We actually vote as to whether we recommend the consumer advocate support or oppose particular pieces of legislation, and the consumer advocate has followed those recommendations. However, giving us oversight authority would clarify that. But the real authority that we have is that we recommend to the governor who should be the next consumer advocate. So if the consumer advocate wants to get reappointed, and not all of them do, some of them retire, some of them go on to greener pastures, they need to be nice to us and listen to what we have to say, because we're the ones who recommend whether or not they get reappointed. So that isn't changed in this bill. So yes, I think it's a good idea, and this is on page 2, line 17, oversight. There are a couple of other things that I think you should be aware of in this bill. If you go to page 1, line, let's see, 14, 3 additional staff people. You're reducing the size of the office basically from 6 to 4, because in addition to these 3 staff people, you have the consumer advocate. The problem with this is that you're going to have to increase the amount of money he spends on experts. Now, we pay our state employees roughly between $50 and $75 an hour, benefits included. Experts charge $250, $300, $500. So if you want to go ahead with this, number one, finance is going to have to raise or you would have to raise the amount for experts. And number two, I would hope that if you're really serious about being effective with the PUC in reducing electric rates, that you would give the same authority to the consumer advocate that you give to the Attorney General. When the Attorney General doesn't have enough money in his budget to hire experts for various cases that he's pursuing, he goes to fiscal, and fiscal says, yes, you can have another $1 million. Now, obviously, the consumer advocate isn't going to be asking for $1 million, but it would be very helpful if you put in that authority so that if, in fact, with a smaller staff, he needs more experts, and in a particular case would exceed his budget, he has the ability to fight on the behalf of electric ratepayers. The 2 main duties, this is page 1, lines 26 to 30. I personally think that's a great idea. The problem is that you don't, the bill doesn't require the other parties that need to have this as their duty to have it as their duty. For example, you've got the PUC, you've got the Department of Energy, you've got the governor, and others, and utilities, and obviously the utilities who themselves are doing this work. Everyone has to know that that's state policy. And so to the extent that you want to do it on the consumer advocate, you need to make it state policy. Then the consumer advocate, as all the other agencies, would be following this. If you just do it on the consumer advocate, it's pretty ineffective, because he really is not going to have the ability to succeed in this. He can try, but he doesn't have the ability to succeed because he's alone. The PUC doesn't have to do it. The energy doesn't have to do it. The governor doesn't have to do it. So,
and then to clarify, that
Yeah.
is on providing the highest level of reliability?
Yes.
That's the part? Perfect. Thank you. And Representative Schmidt had a question as well, if we may.
I don't mean to interrupt you, because everything you're saying is very important to me. But the thing is, when you were talking a moment ago about the budget, whether you're going to give the consumer advocate more staff or more requests to go to finance or fiscal and get more. Nobody can speak better to join fiscal than you, as the former chair of finance for so many years. But the thing is, which is the better way to do it? To give him or her more staff or more or to defer to going and getting another $1 million for the budget. his
think,
budget.
I think thank you for the question, Representative Schmidt. I think we would get more bang for our bucks, and that's one of the things that's important to me, with more staff. They're less expensive and would be on duty all the time. It would increase the number of cases the OCA could actually deal with. In fact, if you increase the staff, God forbid you heard me say this, if you increase the staff, he would be even more effective.
Thank you.
Well, he made the argument himself very subtly, but nevertheless, the bottom line is, if you take wheels off the car, it don't run as well.
Fair enough.
And I would like to note that in section 2, the 3 additional staff people is current statute. This is just changing to allow another attorney and rate analysis. So changing who is within that 3. Current state laws, it does say 3 additional state staff people. So that's no change in head count.
Thank you for that. I didn't realize that.
That's the challenge of an amendment that doesn't have all the other sections with the secretary and whatnot.
Excellent.
Assistant.
Then you can, then I retract my suggestion about giving the office the same power as the AG. I think their budget now is appropriate for the current staff and for the outside experts.
Thank you.
On
And I interrupted you when you were in C, talking
Yes.
about the need to share that with other sections of government.
Yes. The next point is on, starting on page 1, line 31, section D, a failure to fulfill these responsibilities is subject to removal by the governor, and then it says what the advocate can be removed for. I have no problem with that, but I think the language needs to be tightened because it looks as though it is so worded that a governor could, in effect, replace the advocate, even if were doing a good job, because she didn't like him. I think it's important. I think it's sensible, but it's not clear enough so that it doesn't become a political football. The one thing you don't want is to have the consumer advocate as a political football.
No, sorry.
That's it.
Representative Schmidt?
So I want to jump right in there because we must have statutory language someplace that does a better job of what you're talking about there. Can you point us in that direction rather than have us craft language that may not do as good a job as we already have someplace else in statute?
Thank you, Representative Schmidt. I cannot do that, but I suspect the folks at Legislative Services can find the appropriate language. Okay. But the concept is a good one. It's just that it needs to be tightened.
I agree.
Thank you. I appreciate that. And this is one of the good reasons to have a work session on these new amendments. So are there any other questions from the committee members? Seeing none, thank you very much. I appreciate all the hard work of everybody today. It's great that we were able to have a few of our bills, 4 of our bills move on to the next stage. Is that on the amendment? Okay, yes, I'll give you just a few minutes to do that. And I also recognize we may have some people that are getting into blood sugar issues working through lunch, so I recognize that as well.
I promise to be.
Oh, could you press the button so?
I think I pressed it to shut it off. My name is Patrick McDermott. I am the volunteer, make sure you understand that, the volunteer state president for AARP New Hampshire, and I live in Hooksett. I represent the 150 plus or minus volunteers that AARP has. Several of my colleagues are back here with me today. And more importantly, the 212,000 members that we have here in the state of New Hampshire. We're very, very proud of that. I just want to point out the elephant in the room here that no one's really said, particularly when we're talking about advocacy. New Hampshire has some of the highest electric rates and energy costs in the country. I worked for over 40 years in the energy industry, most of it with PSNH, now Eversource. I'm well aware faced it every day of how expensive our product was. So I think that's very important when you talk about weighing residential interests with the interest of the utilities. As Mr. Kreist pointed out, the utilities have a lot of money and they have a lot of attorneys, and so having a valuable and effective consumer advocate is really important in this state. And we were joking about representing the elderly. Not only am I in that class, but I also represent at ARP the 50 plus. So the 212,000 members are 50 plus here in New Hampshire. I'm here to speak against actually the proposed amendment to this bill. Basically, as has been said before, this amendment makes changes that are not necessary. The Office of the Consumer Advocate currently runs effectively and efficiently, and they're doing their job. The proposed changes would result in a more narrow definition of the duties. We talked, Mr. Kirk talked about that a little bit as well. And it could make the office less flexible and less efficient. Therefore, again, I just state our opposition against these changes. Thank you.
Thank you. Are there any questions from the committee? Thank you very much, Mr. McDermott. And thank you all for your work. We know of our 9 retained bills, 4 of them we've taken final action on to bring to the floor. We'll get those reports in quickly so that we can get those done and we aren't scrambling for them come November. And still have some more work ahead of ourselves, but I think we're making great progress and I want to thank you all. And with, sorry, with the next meeting, I think we'll take a look at it, see how much work we need to do before the next meeting. We definitely won't be meeting next week, with the potential of maybe meeting the week after that, but let's see what we need to have and if we need a little bit more time. All right, and, sorry.
My name is Alan.
Actually, sorry, this actually isn't a public hearing. This is a committee work session. I'll speak with you afterwards, but I am going to go ahead and adjourn our full committee work session, and then I'll come over and speak with you. Thank you. And with that, thank you all. We're done.